Hi, it has been weeks since we've last spoken. I'm going to talk about nosebleeds in the ER. Once upon a time, I asked for suggestions about what to talk about after A to Z of emergency medicine, and someone asked to talk about nosebleeds. And so we have a couple of medications that we can use for nosebleeds. The first and probably least invasive is silver nitrate sticks. They come in a pack with multiple inside, but they look like little wooden sticks and they have little silver nitrate at the top, and you can put it on the wound if the bleeding is not too bad, and it actually cauterizes or burns a little bit right along the spot where the bleeding is happening. Yeah, I hate it. It looks very wooden and very uncomfortable and right along a sensitive space, so I hate them. Those work sometimes. The thing that we do the most commonly these days is tranexamic acid, or TXA. TXA slows the conversion of plasminogen to plasmin. Plasmin's job is to break down the fibrin clot. So TXA slows the breakdown of clots, allows the body to form clots, and it slows the breakdown. So TXA, tranexamic acid, can be put on gauze or on a rhino rocket, which is like a tampon that we shove up the nose, and used topically, just straight drug into one or both nares. And it's actually pretty effective topically. There's no clot risk systemically because you're just using it just like right there in the nostril. So we use that pretty often. It doesn't have any effect on any systemic anticoagulation. So if the patient is on Coumadin or apixaban or rivaroxaban or whatever, there's no problems there. So it's just like 1 gram of TXA. Again, slows the conversion of plasminogen to plasmin, which slows the breakdown of the fibrin clot and allows the nose and the body to kind of do its thing and for clots to form. So we use a ton of that. We can use cocaine. It's the only medically approved, FDA approved indication for cocaine. Makes it a C2 instead of a C1. C1s have no medical use. Cocaine actually is a C2. It's a 4% solution. Same concept. You put it on gauze and put it up in the nose. It actually it's a potent vasoconstrictor, so the vasoconstriction happens and the bleeding stops. For lots of reasons, not the least of which is diversion. We don't use it very often. It's really hard to dispose of. Once you use it, there's a lot of paperwork involved as far as like, did you use the whole vial? And if you didn't, how do you waste it? And the DEA, gross. The DEA requires a lot of different things to be done paperwork wise if you don't use the whole vial. And there's just a lot of logistics that go along with using cocaine 4%. So we do still have it. Mostly it's used by ENT. So if we've tried the other two things, the TXA and the silver nitrate, and the nose is still bleeding, then ENT is called down to the ED, and then we will use the cocaine 4% solution in the nose. But yeah, it's not our favorite. We used it a lot more when I first started in the ER 10 years ago than we do now. TXA is a lot more common. So that's nosebleeds.